Hope everybody's doing well. This live is coming a little bit late, but it's much better that I come than not. In this live, I wanted to discuss with you about postpartum bleeding and dealing with it. What is normal, what is not normal, what to look out for, and when to get concerned, and what to do if you're concerned. So this is the bleeding that you're going to be experiencing following the delivery of your baby. And of course, how long it's going to go on for and all that kind of information as well. So postpartum bleeding is quite common, is something that does happen when you are when you've delivered your baby, and we do expect it to be there. It doesn't matter even if you had a cesarean section, you're still going to have postpartum bleeding, okay? Because the blood is coming from the womb where the placenta has been detached from. So the area where the placenta used to be attached is where your bleeding is going to be coming from. So whether you've had a cesarean section or if you've had a vaginal birth, you're still going to have postpartum bleeding, and this is normal. Postpartum bleeding can happen up to 6 weeks post delivery, but at some point during that time, you will have a period where you're not going to be having any bleeding at all. So, for example, the first 2 weeks or so, 10 days to 14 days following the birth of your baby, you are going to have some bleeding, okay? You will have some form of bleeding every single day in that few days, and this is okay. The heaviest time during the postpartum bleeding is definitely the first 2 days following the birth. This is when you've had your baby and you've been using really big tampons to help to soak the blood. You may have to change your pads maybe every 2 hours because you're feeling like you are dirty and you just need to keep it clean and keep it refreshed. Okay, so the first 2 days is going to be quite heavy. So please make sure that when you're going to hospital, you pack in your bag some heavy absorbent. Hello there. Thanks for joining the live. Please like the live for me. That would be amazing. And if you like the content, then please subscribe to the channel as well. I really appreciate it. I'm talking about postpartum hemorrhage and postpartum bleeding. So once you've had your baby, the bleeding that you get during the delivery, okay, and after the birth. So once you've had the baby, the first 2 days you may have a lot more bleeding than what you may be expecting, but this is normal. As long as you're not continuously flowing and bleeding, then this is not a concern. You may have to change your pad every 2 hours, and this is okay as well. At this time, if you're concerned at all about your bleeding, please make sure that you do let the doctors know when you are in hospital, or if you're not in hospital, you make sure that you are calling in to check for the doctors to have either bring you back in or to make sure that you are okay. Okay, just to give you some reassurances. So please make sure that if you're concerned, you call the hospital to get some advice. Once you're home, let's say you go home about day 3, you're still going to be bleeding. It's not going to be as heavy as your first day or your second day, but you're certainly going to be having some bleeding where you're maybe changing every 3 hours, and this is okay. What is not normal for you to have is clots, okay? The first day or 2, you may experience some clots, and this is okay. You will be in hospital, so you can always get the attention of the midwives to have a look at them and see if they're concerned or if they're worried. If you are at home, then please make sure that if you're worried again, you will call up to get checked and you get somebody to have a look at the clot. If you can save it or take a picture of it, it will be good. So if you go into hospital, you can show them the size of it, because what we don't want is for you to be experiencing clots which are bigger than this size. If you're looking at maybe a 50p coin in the UK, it's about this size. Make sure that the clots that you're experiencing are not bigger than this, okay? If they are bigger, so you're getting clots this size, really big clots, then please, you must make sure that you're seeking medical advice to make sure that it's all okay and it's just a clot and it's not a part of a placenta or the membranes that is still passing, okay? Because this is not normal. We do not want you to be passing placenta pieces or membrane pieces at home or in a hospital. So when you're at home and you're starting to experience this bleeding, it's very normal. You shouldn't be passing clots bigger than a 50p coin. You may be having some small little clots, little tiny amounts and things like that, okay? And that's okay. The time that you may be passing clots is the time that you may be bleeding more is if you were doing breastfeeding. So during a breastfeeding, when your baby is suckling at the breast, the uterus contracts, okay? So it contracts and it squeezes more blood out. So if you are breastfeeding, whilst your breast is latching, your baby is latching or is latched on, you will experience some more blood that you will feel like you're bleeding more. And again, this is normal, but it shouldn't be anything heavier where you're feeling like you're bleeding through your clothes or you're bleeding through your bedding or your couch or wherever you're seating. This is not normal. Again, if you're getting something like that, you need to go in and get checked out, okay? Of course, when you get to a point where you feel like you are excessively bleeding, you are concerned, you're worried, you tell somebody else or you tell your partner and they're worried, they're concerned, please always go in. Postpartum bleeding can escalate to a hemorrhage. And this is very, very dangerous. It's a very, very big emergency that you need to be seen by doctors. If you're at home, you will need to call the emergency services to come and get you to the hospital as soon as possible. If you are hemorrhaging and you're having bleeding that's just continuously coming, or you're having to change your pads every hour, you've got a full soaking pad, or you're going bleeding through your clothes or your underwear or anything like that, okay? It should never be like this. Your bleeding can last up to 6 weeks, okay? You can have bleeding up to 6 weeks, but like I said, the first 2 weeks is where you're going to be experiencing bleeding every single day. The amount will get lesser and lesser each day, okay? But by 2 weeks, you feel like you're experiencing almost at the end of a normal period, and this is normal. Following on from that, you may have some days where you are not experiencing any bleeding whatsoever, even when you are breastfeeding, and this is okay as well. But you may then go back to having some bleeding or some discoloration of some form of blood whenever you wipe, when you go to the toilets, and this is also normal, okay? So if you're going between bleeding 1 minute, then you're not bleeding anymore, then it comes back again, as long as it's not excessive, meaning you're changing your pad very consistently and very often, like hourly, then this is okay. But let's say you're 4 weeks post-delivery, your bleeding that you're going to be getting would have changed color, so it's no longer really deep red. It's going to be either really old looking brownish blood red coming, or you may be having some pinkish blood coming, or you may be having some little bits of discharge with a mixture or strings of blood or old looking blood. Again, this is very normal, but up to 6 weeks, you may be experiencing some bleeding. It may be very intermittent, so sometimes it's there, sometimes it's not. Sometimes you get more, sometimes you get less. And this is very, very normal. So do not worry about that. The part where you are going to be concerned, like I said, is if you're bleeding a lot and it's coming very often and you're having to change your pad very often. But another part to be worried about is if you are passing clots and these clots are not looking like clots, okay? So clots are very shiny. They're very wobbly, like jelly-like, okay? If you were to poke it, it will break apart. What we don't want you to be passing is what looks like a clot. So it's very thick, but it's not jelly-like, okay? It looks a bit meaty. This could be a sign that there might be a placenta piece that you've just passed. If there's a placenta piece in the uterus that you are passing through bleeding, this is very, very dangerous. It needs to be removed, and therefore you will need to be back admitted to the hospital so that they can scan you to make sure that this is not something that they need to take you back to theatre for, or go into theatre for the first time to go and remove this manually. If you are having clots coming and you're not sure if they are clots or if they're products such as a placenta piece, please go in and get checked. It may be also that you may have an infection in the womb, and which means that you will be having these sort of clots and bleeding. You know, sometimes you're bleeding a lot, sometimes you're not bleeding a lot, and therefore you might need some antibiotics to clear this up. So if you are having bleeding that is really inconsistent, you're not sure whether it's stopping, is it coming back, then please do contact your healthcare professionals and let them have a look and just have a chat so that you are at least made reassured that everything that's happening is okay. All right. Also, make sure that you are aware of the days and that you are on So like I said, if you are bleeding the first 2 days, you're having more bleeding than you would be at day 5 or day 10, or even possibly at around the 1 month period. If by 1 month you start to bleed a lot more than you were maybe at week 2, at your 14 days, again, this could be a concern. So you need to be getting looked at. You need to have assessment. You need to get reviewed, because your bleeding should be getting lesser and lesser and lesser as the day goes by, up until your 6th week, where you have no bleeding at all. Okay. If you are somebody that is breastfeeding, once you get past the 6 weeks, your normal menstruation may not resume again yet, because you are breastfeeding solely. Okay. Although you are not experiencing bleeding following the 6 weeks because you're breastfeeding, please don't take this to mean that you cannot get pregnant if you were to have sexual intercourse, which is not protected, and you're not using any protection as well in terms of birth control or anything like that. Okay. You can still ovulate when you are breastfeeding, even though you're not getting a period. This is very, very normal, it's very common. And if you are not careful, you could get pregnant sooner than you would like. So please make sure that you are thinking of your birth control after you've had a baby, or even before you've had a baby, to think what you're going to use after you've had your baby. So you will find out when you can start using birth control. If you're taking things like the pill, normally you can start or resume it back around about your 3-week post-delivery. But if you're doing things like a coil insertion or anything like this you will have to wait until at least past your 6 to 8 weeks period after your baby is born. Okay, so please be mindful that if you are breastfeeding, your periods may not return. Okay, it will not come back. You're not going to experience any period type symptoms, no PMS, anything like it, but you can still ovulate. So your ovaries can still release an egg. So if you're not protected and you're not careful, you can get pregnant. So please bear that in mind. But if your period was to come back, it may not come back and be the same as what you were used to before. So it's not uncommon for women to start having periods again following the birth of their baby, let's say 3 months down the line, and you are starting to see your period, but it comes and is no longer the 6 days as you're used to, but it may be only 3 days, it may be only 4 days, and then it stopped. Or sometimes it may be longer than what you were used to. You may have had only periods for 4 days or 5 days, and then now when you're getting your period after your baby's born, your period is now lasting 6 to 7 days. Again, this is normal. It's all part of your hormones resettling and things getting back to normality. So please bear with yourself. It's very, very normal that you may have differences in your periods after you've had your baby. Another thing to remember is that if you were only doing formula feeding and you are not breastfeeding, in majority of the cases, your period will return as usual after the 6-week period. Okay, so after you've done your 6 weeks of postpartum bleeding, your normal period will resume as you were used to before. Again, it may be different to what you are used to, just like I've said, but it's always normal if you are getting your period straight away after 6 weeks, and every month you are, your cycles are returning back to normal and nothing else is changed. This is very, very normal. Another thing to mention is that once you've had a baby, if you were really, or if you struggle to become pregnant the first time, please don't think that you're going to be struggling again to conceive your second child, okay? Because it's very, very normal that once you've had your baby, your body almost resets itself. So even if it took you maybe 2 years to conceive the first one, or maybe you did an IVF to conceive your baby, or you had some intervention to conceive, anything like this, that you'll find yourself that you're pregnant soon after. And where you're thinking that you're not going to get pregnant really quickly because it took you so long to have your first baby, now you've had another one and you're pregnant again. You are not expecting this because, you just didn't think it could happen. But remember, once you've had a baby, your body literally resets itself. It becomes clear as a whistle. So if you did not want to have baby straight away, or you're not planning your family to be really close in age, then please make sure that you are using some form of birth control after you've had your first child, okay, or your subsequent children, if you don't want to have one very soon after. So remember that postpartum bleeding is very normal, is common. It is going to happen whether you've had a cesarean section as well as when you've had a normal delivery, because it's not a bleeding that's coming from the vagina, okay? Some people are quite surprised. It may sound silly, but it is a common, assumption that you think, well, if I had a cesarean section, then why am I bleeding? There's no more blood coming from the cesarean section wound. So why is it that I'm bleeding? But you are not bleeding from the vagina. You're not bleeding from your cesarean section wound. Everything in terms of cesarean is always going to be stitched up. It's going to be closed. Absolutely nothing is open for you to bleed from. But you're going to be bleeding from the uterus inside the womb, okay? So your uterus is the womb. When you have your uterus, you have a placenta that was attached to the womb, where baby was inside getting fed and growing and all that nutrients and all the amazingness that's happening to build your baby. Once that placenta comes away, the area of the uterus is now got a wound, okay? This area is where the bleeding is coming from. Now, the inside the womb you will have is quite jagged in there. And whenever you breastfeed, like I said, or after your baby's born, your uterus continues to contract to try and close this wound, okay? And this is where you're going to be bleeding whenever it's contracting and is moving, such as this movements, okay? Now, one thing that we don't normally mention when it comes to midwives and doctors is that there is one thing called after birth pains, okay? This pain comes from the fact that your uterus is contracting to close the gap that's there and to heal the wound. But let's say if you're having your first baby, when your uterus is contracting after your delivery, few days later, you are not going to feel this sensation, okay? And this is okay, because it's your first time. Your uterus doesn't have to work so hard to close this the wound and also to heal you. But after you've had 2 babies, a 3rd baby, a 4th baby, this contracting and this sealing of the uterus and the things that your body's doing to heal you is very, very painful. This is called the afterbirth pains, okay? It feels like a contraction again. Although you're not having a baby again, you've already had the baby, everything is fine, you may be home, but you're going to experience this pain where the uterus is contracting and you're feeling like the sense of contractions again, okay? Please take some painkillers if you are in pain from this. It's very, very normal and it's very, very common. It just shows that your body is doing the right things, okay? And is doing what it needs to do. It can get really, really painful if you are breastfeeding. Let's say you've had your 3rd baby and your uterus is doing this contraction anyway, and you are also the uterus is contracting and is your 3rd baby or your 4th baby, you're going to feel like you're having contractions again because your body has to work really hard. Remember, every time you have a baby, your uterus gets bigger. Okay, and this is why some women will have a baby and their stomach doesn't go back to their original size again, because the uterus is much bigger. Or when you get pregnant for the 2nd time from your first, you will find that you're looking much bigger than you really are in weeks. So on your first pregnancy, you may feel like, you didn't show any bump until you were maybe 5 months. But with your subsequent babies or your 2nd, 3rd baby, as soon as you become pregnant, even at 12 weeks, you may look like you have a bump. And you're wondering like, oh, why do I look so much bigger? This is because the uterus has been expanded before. So it's easily able to move out of the pelvic area to come to the abdominal cavity and look much bigger. And of course, there's also bloating, which you feel more when you are pregnant with your subsequent children. So if you are pregnant for the 2nd, 3rd, 4th time, this afterbirth pains can be very, very painful, okay? So please do bear that in mind when you're at home and you're thinking, oh, why am I in so much pain? I feel like I'm having contractions again. This is what's happening. Your uterus is doing what it's meant to do and cramp down, get all the blood out and shrink back down to size, okay? That is what is happening. And this is called the afterbirth pain. So it's very, very normal to experience this kind of discomfort and this kind of pain. So when you are experiencing this, you find that you're getting more blood and this bleeding is coming and all of that kind of stuff. So this is very, very normal, okay? Thank you so much for everybody that's here listening to the live. Please do give me a thumbs up because it helps me and it helps to push the video out to other people as well, especially afterwards that I've uploaded the video. If you are happy with this content, please consider subscribing to the channel and then click the notification bell so you can see when I come live again. The next time I'll be coming live will be on Friday evening, and I'll be discussing all things relating to pregnancy and birth. If you have a question, please leave it in the comments now, and I'll be happy to answer it for you. If not, you can come back and upload it into the comment box once this video is uploaded. Okay. So what is not normal, as I said, in clots, just to recap with the postpartum bleeding, is for you to be bleeding and having to change your pad every hour. This is not normal. Okay. If you're changing your pad, you've gone home from the hospital, everything was fine, and then suddenly you're starting to bleed more heavily. You're changing very often, and you're becoming like every hour you're changing, or you're bleeding through your clothes, you're bleeding through your bedding, or anything like this. This is not normal. You need to seek medical advice. Okay. You need to be seen and get checked. Also, if you start to pass clots that are bigger than a 50p coin, it's not normal. You need to go in so they can do a scan to make sure that there's no pieces of placenta left inside the uterus that needs to be removed, or that you have an infection that you need to be given antibiotics for to help clear all of the clots that's left inside. This is not normal, okay? These things are not normal. What is normal is if you were changing your pad every 3 hours, you're not particularly filled with this, with the pad. You're changing mostly just to make sure that you're keeping clean and fresh. You are seeing that your bleeding is getting lesser and lesser and lesser each time, that by the time you get to week 2 of following the baby's birth, you are no longer experiencing some bleeding, okay? You are having some days where you're not having any bleeding at all, or some days where you're having some bleeding and little bits of clots. So little bits of clots, very small, 5p size, little stringy ones, all of that is normal. Okay, what's not normal is the big ones that is bigger than a 50p coin. Please remember this. Okay, don't think that, oh, because I've just had a baby, it's normal that I'm passing clots. No, it's not. You should not be passing clots. The only time you may pass clots will be the time that you're in hospital, and therefore you can call the staff and they'll be able to have a look and just reassure you. If they're concerned, they'll get the doctors to come and reassess, or anaesthetists come and reassess, or take you back to theatre. If they're concerned with postpartum hemorrhage, then they will deal with that in hospital. But the time that you are at home, you should not be getting any kind of worrying bleeding signs such as what I've mentioned already. Okay. If you are ever, not sure about something, or you are bleeding to a point where you're not, you haven't been told, it's sort of off and on, you're thinking to yourself, this doesn't seem normal, I'm not sure, or you're feeling like you're not confident to call anyone, or you're thinking they will think you're being silly, or you're over, thinking it, or anything like this, please do go with your instinct. Okay. If you are feeling like something is wrong, make sure you go in and you get checked. Do not just hold your feelings to yourself when it comes to postpartum bleeding. Please make sure that if it's something seems wrong, if you're feeling that there's something happening that you're not sure of, you haven't been told about it, or what you are aware of is slightly different to what you're experiencing, then please go in to get checked and get reviewed, just so that they can make sure that everything is okay. All right. I hope this video was helpful to you and this live was helpful to somebody. If you are, you want any more questions answered, please send me a message in any of my videos and I'll be more than happy to answer it for you. And thank you so much for joining the live, and I will see you in the next live on Friday. Take care. Have a lovely evening. Bye.